If you are retired, or if you are anywhere near sitting down to plan for your golden years, you need to hear what I am about to say right now. Because every single fall, starting on October 15th and ending on December 7th, a massive window opens up that can either protect your hard-earned money or quietly drain your retirement savings completely dry. It is called Medicare Open Enrollment, or the annual election period, and I am going to tell you the raw truth about it. Most people screw this up. They do. They stick their head in the sand, they ignore the mail, and they pay for it for the next 365 days. I don't want that for you. You work too hard for your money to throw it away on hidden healthcare costs, high prescription copays, or doctor networks that change overnight without you even realizing it. So sit up, pay attention, and let's talk about what Medicare Open Enrollment really means, why you should be terrified of doing nothing, and exactly what steps you need to take today to stand in your financial truth. First, let's address the fear that so many of you have, even if you won't admit it out loud. The fear of getting sick and realizing your insurance doesn't cover what you thought it covered. The fear of going to pick up a life-saving medication at the pharmacy counter, handing over your card, and being told, that's going to be $800 out of pocket this month. Where do you think that money comes from? It comes right out of your nest egg. It comes out of the money you set aside to live on, to travel with, to leave to your children and grandchildren. Doing nothing during open enrollment is an active decision to hand over control of your money and your health to an insurance company that is looking out for their bottom line, not yours. Now, let's answer the core question: what actually is Medicare Open Enrollment? Between October 15th and December 7th every single year, Medicare gives you the legal right to audit, tweak, or completely overhaul your health coverage for the coming year, taking effect on January 1st. This is the time when you can switch from original Medicare to a Medicare Advantage plan, or drop Medicare Advantage and go back to original Medicare. It is the time when you can switch from one Medicare Advantage plan to another, or swap out your standalone Part D prescription drug plan for a completely different one that actually covers the drugs you are taking today at a lower price. Notice what I said: you can change things based on who you are today, not who you were 3 years ago when you first turned 65. Your health changes. The healthcare market changes. The law changes. If you are not evaluating your coverage every single autumn, you are asleep at the wheel. I want you to think about this logically. If I told you that by spending 1 or 2 hours in October or November reviewing your options, you could save $1,200, $2,500, or even $5,000 next year, would you do it? Of course you would. So why aren't you doing it with your healthcare? Why do people avoid this? Because it feels overwhelming. All those glossy booklets, all those television commercials with retired celebrities telling you to call a toll-free number to get all the extra benefits you deserve, it creates confusion. We are going to break this down into clear, powerful, actionable steps that put you in total control. Here is your action plan. Step number 1, in late September, an envelope arrives in your mailbox. It says Annual Notice of Change, or ANOC. Most people take that envelope and throw it right into the recycling bin with the junk mail. Do not do that. That envelope is gold. Inside that document, your current plan is legally required to tell you every single thing that is changing for the upcoming year. Is your premium going up? Is your deductible increasing? Are copays changing? Did they drop your doctor or your hospital? You sit down with a yellow highlighter, you open that notice, and you read it cover to cover. If you see changes that cost you more money or restrict your care, that is your signal that it is time to shop around. Step number 2, look at your prescription drugs. I want you to make a list of every single prescription medication you take right now. Write down the exact name, the dosage, and how often you take it. Then, go to Medicare.gov. Do not rely on commercial marketing websites, go directly to the official government tool, Medicare Plan Finder. You type in your zip code, and you type in your exact list of medications. The system will run the math across every single Part D drug plan and Medicare Advantage plan available in your area. It will calculate your total out-of-pocket costs for the entire year, premiums plus drug copays, and rank the plans from cheapest to most expensive. You will be shocked, to see how often the plan that was best for you last year is suddenly $1,000 more expensive than a competing plan this year for the exact same pills. The savings are sitting right there waiting for you, but you have to go look for them. Step number 3, check your doctors and your network. If you are on a Medicare Advantage plan, you are in a managed care network, usually an HMO or a PPO. Do not assume your doctor is going to stay in that network. Doctors and hospital systems enter and leave insurance networks all the time. Call your doctor's office directly, do not just trust the directory, and ask the billing department, will you be accepting my specific Medicare Advantage plan for the upcoming year? Get a clear yes or no. If the answer is no, and you want to keep that doctor, you must change your plan during open enrollment. Step number 4, do not fall for the $0 premium trap. Oh, this drives me crazy. Listen to me. Nothing in life is free. A $0 premium simply means you are not paying upfront every month. It does not mean the care is free. You will pay on the back end through copays, coinsurance, deductibles, and strict network limits. If you are healthy and rarely see a doctor, a lower premium plan might make sense. You cannot separate them. A health crisis that isn't properly insured becomes a financial crisis overnight. You have the power right now to protect your peace of mind, to protect your bank account, and to ensure that you get the quality medical care you deserve without going broke for it. Take ownership of this. Mark October 15th on your calendar. Open that annual notice of change. Compare your plans on Medicare.gov. Stand in your power, secure your retirement, and make decisions that honor the hard work you put in to get here.